Hello everyone, this is Danny. Today I am going to give you education on subcutaneous butterfly insertion. Uh, Before I am going to administer butterfly insertion, I need to clarify the physician's order if the route is by subcutaneous butterfly and what is the prescribed medication to administer. So after clarifying the order, uh, I will inform the patient that the doctor ordered pain medication uh, through subcutaneous butterfly route, and I need to administer that butterfly catheter before I can administer the pain medication. So I need to practice aseptic technique. I need to wash my hands in 30 seconds to prevent any contamination. After washing my hands, I will collect my supplies. And as you can see in the picture, I prepared two subcutaneous butterfly. One is blue one is yellow one, and they are double port. And on the top of the picture, you can see a red cap that will cover the other port. And today I will use the yellow one, and the blue one is a backup in case I need it. So just for information, the subcutaneous butterfly that we're going to use, they have both product by Safety Intima. As you can see, safety system with Y adapter. So both of them has a double port. As you can see in the picture, they have the same size, 0.75 inches, but one is 22 gauge and one is 24 gauge. So it's just for information. In the picture, there is also one subcutaneous butterfly, but this one has a single port and it is shorter compared to the other two. And this one will only need prime with 0.25 ml of liquid medication, example hydromorphone. But it functions the same as the other two. The only difference is it only contains single port for this one. And in the picture, you can see the hydromorphone vial, 2 milligram per ml. And also there are two syringes. The other one I will use to withdraw medication for the prime, and the other one is for the ordered medication by the physician. It's for the dosage that was ordered to be given to the patient. Next, I have gathered some more supplies. This one, there are two blunt needles. They are bigger and it's faster to withdraw medication. And one sterile gauze, two pieces of alcohol swab, and one tegaderm. The tegaderm, I will use that one in the injection site to cover it and secure it. And I will put a label on it and date when I administer that subcutaneous butterfly. Here is another supplies that I will need. One is the cling in order to wrap the subcutaneous butterfly site. Some patient, especially confused patient, if they saw one, sometimes they pull it out. So in order to secure that one, I will cover it with cling. And I have tapes there. uh, surgical tapes, and I have a connector that I'm going to put on in the end of the one of the port of the subcutaneous butterfly, and I have one dose there and scissors. This is one normal saline, but we're not going to use this one because we don't flash normal salines on the subcutaneous butterfly, only for this IV, only for the IV. And so, and one insulin needles is just for additional information. But the one we're going to use is the cling dressing, connector, tapes, and the gauze. So this is a list of medication used for priming butterfly for subcutaneous injection. It is zero point 0.4 ml, but I would suggest you consult your policy and procedure in your own facilities because it sometimes varies with the other facilities. So you have a 7 list of medication here that you can use to prime your subcutaneous butterfly. It's just for references. These pictures just to show you how to withdraw medication from the vial. As you can see, the needle is inside, and in order to withdraw medication, you need to pull down the plunger downward to get your medication that you're going to give to your patient. Uh, there is also another picture here that showing how to withdraw medication from the vial. And there is a rubber stopper, needle, vial, and all you have to do is turn the vial and syringe upside down so the needle points upward, then pull back on the plunger to withdraw the correct amount of medication. So after your preparation is done, you need to remove your gloves and perform hand hygiene. Now it's time for to select the insertion site, and as the photo you can see what site you want to insert your subcutaneous butterfly. But before doing that, the site must not be lymphedema, erythema, edema, or broken skin. Skin sites that have been irradiated as absorption may impaired. Site with infection or inflammation or desquamation is present. Areas of bony prominence, tumor site, and skin folds. Uh, in general, only initiate a subcutaneous cannula on healthy skin. So you need to check for anything that is not suitable to inject on that site. Subclavicular chest wall area. Avoid using this area when patient has lung disease or is active. Risk for pneumothorax. Pneumothorax is air in the cavity between the lungs and the chest wall, causes the lungs to collapse. Ensure caution is taken when using this site. There may only be a small amount of tissue between the chest wall and the underlying lung, which results in a risk of pneumothorax. In order to decrease this risk, pull the skin away from the chest wall and insert the needle at a shallow angle. And when you identify the site, clean it with alcohol swab. Please check your policy and procedure. Uh, Outer arm, abdomen, at least 2 inches away from the umbilicus. Avoid abdominal distension. In the thigh, avoid if trauma is present to the thigh. In the upper back, use when other sites are not suitable. Confuse patient. There is a risk that the patient may pull out the catheter. So those are things that we need to pay attention on selecting our site. As you can see in the picture, the site was infected. The skin is red. We don't want this to happen to our patients, so we need to select the appropriate site to insert our subcutaneous butterfly. So after all your preparation and assessment is done, now it's about time to do the procedure. So before that, you need to do a hand hygiene again, wash your hands, and then wear your gloves. And after that, you need to scrub the injection site with alcohol swab and allow the skin to dry completely. And after that, hold the catheter as illustrated in the picture. You need to rotate the safety barrel 360 degrees to loosen the needle. So after your preparation for the needle is done, you need to ask your patient to position herself in her comfortable position before inserting the subcutaneous butterfly. So now you need to hold the wings of the butterfly, grabs the pebble side of the wings, bringing flat inside together, ensure bevel is oriented and upward so that you securing it easier to insert if you're having a good grip on the wings of the subcutaneous butterfly. Next, you need to grasp skin around the insertion site to create a fold skin. Insert the needle through the skin at 30 degrees angle. Insert full length of the needle. Pay attention of the bevel if it is up and the bevel side wing down in order to secure the subcutaneous butterfly. Release the wings of the catheter and stabilize the butterfly on the skin surface with your fingers to secure the catheter. Next, you need to secure the subcutaneous butterfly. As you can see in the photo, two fingers is securing the yellow wings so that when you pull it, you won't pull the whole thing. So you need to secure that before grasping this white shield and pull in a straight continuous motion to remove the guide wire. So this is another position when the patient is sitting and it was administered on the left upper arm and two fingers is securing the subcutaneous butterfly wings, and after securing that, now you can pull down that white shield, and after that pull in a straight continuous motion to remove the guide wire. And after doing that, you need to secure the subcutaneous butterfly with Tegaderm. I need to label it. I will put the name on it, and I will put the date. And after that, I will administer the medication that was ordered by the doctor. So after doing that, I will document it in the chart of the patient and document it in the medication administration record. And after that, I will assist the patient and inform it that the procedure is done. And then I will do cleanup. And after that, all the subcutaneous butterfly is already administered.